Hi, I'm Jennifer James, and this is my persuasive speech. According to the National Institute of Health and Drug Abuse, in 2011, 16.4 million Americans aged 12 years and older used some form of illicit or psychotherapeutic drug illegally. Despite these numbers, which are amazingly high, in the last 20 years, only one drug has been formulated specifically to treat addiction. According to the Legal Journal of Medicine, Ibogaine is a root that comes from Western Africa, where the Betwe tribes use it for their spiritual rituals. However, in 1960, Howard Lotsof was experimenting with drugs with his friends and used Ibogaine. The following morning, all of his friends and himself discovered they no longer had a craving for heroin. Because of this, Lotsof decided to start experimenting with Ibogaine for the treatment of addiction. The outcome was that most people that used Ibogaine 1 to 2 times were completely free of their addictions. Scientists feel that the altered state of consciousness is key to the benefits of Ibogaine in treating addiction. The participants who have used Ibogaine say that they see how traumatic events from their past have played a role in their addictions, and now they feel that they're better able to handle the stressors and the struggles and understand those struggles better. Currently in the United States, Ibogaine is considered a Schedule Class 1 drug, which means there is no medical value and the risk for abuse is high. Despite this, all but 8 countries have legalized the use of Ibogaine for experimental medical use. According to the BBC, in 2012, neuroscientist and addiction specialist Deborah Mash contacted Lotsof, and they decided to work together to study Ibogaine. They had the full backing of the FDA in 1995 to start this study. However, pharmaceutical companies pulled the grants because there was lack of financial gain to the pharmaceutical companies, because Ibogaine only needed to be used 1 and possibly 2 times to treat addiction. Because of this, MASH went to the Caribbean and opened her own research center in 1996. She had 300 participants, and after 1 year, just 1 year, 70% of those participants remained free from their addictions. The Journal of Forensic Science states that up until 2012, which is when this study was, only 19 deaths occurred along with the use of Ibogaine. However, 14 of those deaths were caused by the patient's pre-existing health conditions. Now, I do have a graph here that I want to show you pertaining to abuse, and specifically this one is for heroin. It shows the rise in the abuse from 2002 until 2012. Okay, so if you look, in 2002, there were 400,000 people using heroin, which shoots up in 2012 to 700,000 people. That's fairly recent, although the numbers have still increased since then. Something needs to be done. According to the BBC News, treatment of addiction is woefully poor in the Western world. After 150 years of studying addiction, the abstinence rates after 1 year are still no better. The BBC News says that for alcoholics, the abstinence rates after 1 year are only 25%, and for opiate addictions is only 10%. Why can't we do something for these people? Help them to get clean and stay clean. Something such as Ibogaine seems to work so well, it should be legalized. Thank you.